next half an hour or so, what I'll be talking about would be nutrition needs for your growing child, as well as basically some woes or some worries or some symptoms that might bring some concern from you as parents. All right. So what we'll cover today, so nutrition for your little one, poop, what is normal and what is not, colic and reflux, probiotics, as well as some tips for you for parents, okay, because a happy baby and child equals to happy parents, okay. All right, so nutrition for your little one. Okay, so good nutrition, I think all of you know that it's very important for growth and development. So the weight and your height of your child will be tracked as your child grows from a newborn to an infant to toddler stage and beyond. So starting good nutrition practices early can actually help children develop healthy diet patterns subsequently. And you find that with good nutrition practices early on, you find that it relieves you from a lot of stress and a lot of difficulty handling some issues later on that might be associated with digestion issues. Okay. So this is taken from the Health Promotion Board, which I think is a very helpful guide that for parents who sort of start with a newborn, gives you a guide of what to feed, how much to feed, and at which stage, you know, you start introducing food to your child. So we'll start in the first 6 months. So in the first 6 months, basically milk is the only food that your baby needs. So you can imagine that the milk that your baby takes is basically his main source of nutrients, okay, the main source of goodness, okay, for your child's growth and development. Depending on how ready your child is, okay, a guide to starting food would be when your baby is between the ages of 4 to 6 months. I would say majority, I would say the most common age to start is when your baby is close to 6 months. After that, okay, milk becomes complementary, so it's still important, okay, for your child's general growth and health, but you start introducing food because your child's needs have increased, and basically the nutrients from food is also important. So try to give your child wholesome foods, okay, a very balanced diet. I'm sure all of you know what these are, so vegetables, fruits, tofu, protein, carbohydrates, brown rice, cereal. So these are sort of wholesome foods that would be important for your child. Now, as your child grows into a toddler, okay, you can be a little bit more adventurous with what foods that your child's going to need. So in terms of like the groups of food, like whole grains, meats and tofu, fruits and vegetables, basically from each of these groups, you're going to be a little bit more adventurous. You can have different ways of cooking it. So always sort of be very careful of how much salt and sugar you put in, because you don't really want to sort of introduce these additives too early on. And use the natural sweetness, the natural taste of certain foods in your child's diet. And I think get your child sort of used to having a very varied diet. That's very important. So what foods to choose for a start at about 4 to 6 months, okay? So you start with iron fortified cereals. The reason why I always tell parents that iron rich foods is important because at this stage, basically the iron stores in your child's body would start to decline, and this is when you need to give a bit of a top up. Okay, so foods that are rich in iron would include spinach, green leafy vegetables, iron fortified foods and cereals, okay, and red meat, so the stock of beef, pork, you know, red meats are important for iron content. Now, certain foods that are suitable at this stage for an infant, sort of a new introduction to food, would be things like pumpkin, sweet potato, boiled carrots. So these can be mashed up into a very smooth puree, and these are good for your child at this stage. So gradually increase the variety. If your baby's not ready, you feel that baby's rejecting what you're giving, okay, don't give up, do not force, okay, just try again 1 week later. So this goes along with new foods. If your child doesn't seem to accept this new food that you think is good and it's wholesome for your child to have, just don't give up, just try again 1 week later. All right, so this gives a guide of how much food to give. I won't go into too much detail, but you can find this off the web, basically on the Health Promotion Guide. It gives you an idea that milk still forms a fairly big part of your child's diet at this stage. So I would say between 5 to 750 ml. This is the guide. A lot of babies do a little more, that's fine. And this adjusts itself as your child takes more food in a day. All right, so I've gone through this. Okay, so we limit sort of additives like sugar, salt. Try not to give too much processed food, foods with saturated fats. So these are the not so good foods. Okay, what's good would be what I talked about earlier. So avocado, dairy, healthy grains. I think these are important for your child. All right. Okay, so we go on to poop, what is normal, okay, and what is not. So I'll show you some sort of graphic pictures, okay, so be prepared for that. So colic is one of the most common problems that I think a lot of pediatricians see in the clinic, and that forms a fairly big group of why sort of parents bring the little one in for checks early on because they're concerned about crying, a lot of stomach gas and wind. I will speak about colic a little bit more in detail later in my talk, so stay tuned. Constipation and reflux also is fairly common, as you can see from our poll results. So this is something that I will as well touch on later in my slides. So I'll give you a little bit more information and how you can handle it as parents. So poop guide, all right. So what's normal stools? What's abnormal stools? Okay, so if you look on the left of your screen, I put up here a Bristol stool chart that gives you an idea of the different types of poop that we're going to be looking at. Okay, so one basically it's a little sort of round stones like nuts. Hard to pass and they're rather dry. Okay, so a two, okay, basically is sausage shaped but lumpy, quite formed stools. Okay, three is like a sausage, okay, but you see some dry cracks on the surface. Four is when your child's poop is like a sausage but it's small, smooth and soft. Okay, and five is basically sort of little blobs, not too loose, but basically soft blobs, okay, with nice edges that they can be passed fairly easily. 6 and 7 are a little mushier. 7 is actually more liquid, okay, where it's watery and not much of solid in there. So it really depends on what your child is taking. So is it a milk diet mainly? Have you started solids? Is your child taking certain foods more than the other? And basically this changes the type of stools that your child would pass. Something else that is important is basically the color of your child's poop. So good colors to have, okay, yellow, green, brown, all right colors to have. Okay, not all right colors to have would be pale stools, so like a little bit like my background in the back, so beigey, very light clay colored. That's not a good color, so please see your doctor early if you do get such light colored stools. If your child gets a bit of like red bright specks or streaks in your child's poop, again that may signal blood, so again see your doctor early so that we can sort of figure out for you what's going on with your child's gut. Certain foods like orange foods may make your child's poop change its usual color. So don't panic if you've given more pumpkin, squash, carrots for that few days and your child's poop looks more yellow orangey than usual. As long as your child is otherwise behaving normally, having his diet normally, okay, there's no need to worry if you find that your child's poop has turned a little yellow to orange. Just think back of what he has taken in his diet. Now, what is not normal again, okay, is basically poop color that is black like hair. So that's not a good color to have. And usually we need to be checking higher up in the gut to make sure that there's no internal bleeding. So that's something pretty serious. So please see your doctor again if your poop's color is rather dark and almost black like hair. All right, so what is important with poop is basically how easy is it for your child to pass stools and the kind of stools and the color of the stools. Right, so do inspect your child's stools each time he passes because that gives you a lot of information. All right. Okay, so how do I know if my child has constipation? I think a lot of parents ask that because they've heard of constipation, but they don't really know, what constitutes constipation. So if your child's bowel movements are very seldom, okay, very irregular, so maybe 1 week, maybe once, maybe twice, 4 to 5 days in between. When the stools do come out, it's pretty hard, dry, or even like the first picture which I showed you, which was little stones, then you may sort of suspect that your child has constipation. This may come along with a tummy ache, like your child strains, there's a lot of crying, there's a lot of pushing and nothing comes out. So that's also a signal that your child's stools may be really dry and hard and not coming out as easily as it should be. Now, sometimes if you see like a little bit of blood when you wipe your child's bottom, okay, if it's like little red streaks, that may signify a little bit of bleeding, and that can sometimes come with pain when your child is trying to push the stools out. And that's usually due to a tiny anal tear. So at the place where the stools come out, there may be a little tear because the skin around that area can be quite sensitive. Okay, so these are signs or signals that your child may have a constipation. So please see your doctor. Now, if you're unsure, okay, take pictures, bring it along. I always tell parents it's okay to show me pictures, all right, because that gives us an idea of, you know, how dry or how hard, or if there's any blood or anything worrying in the stools. Okay. All right. So if your child has constipation, dry, hard stools, very infrequent, your child sort of forces, sits very long before stools come out, or strains for a long time, what may be the causes? So first of all, I think diet. So go through your child's diet. Is he or she taking enough fiber? Okay, enough fiber-rich foods, enough fluids in the diet? Or is your child someone who just refuses to touch any vegetables, refuses to touch any fruits? Then that may be one of the main reasons why your child's having hard stools. Now, as your child grows to be an independent toddler who wants to do everything and not settle down to eat or to sleep or to poop, basically, you know, sort of holding the urge is very common at this age, and this can continue even up to primary school going age, where the, you know, play is so much more interesting than sitting there and waiting for the poop to come out. So at this stage, there might be a bit of holding the urge, and as the stools stay longer in the intestines, that's when, you know, the stools becomes drier and even harder to pass, and old poop sort of accumulates and new poop is being formed. So you're going to have more problems with sort of a backlog of stools. Now, if your child's undergoing some form of stress at home or at school, your child's emotionally, you know, more upset than before, not usual, okay, sometimes that may disrupt the stool pattern temporarily as well. Okay. So what to do as a parent? Okay, so if you go through your child's diet and you think that, you know, I think the cause is basically not enough fiber, not enough fluids, it's not someone who's going to be willingly taking a water or fruits and vegetables, then do try to be creative in increasing this in your child's diet. A regular exercise, you know, when all of us were confined during circuit breaker, I think that was a period where constipation sort of, I saw more cases of constipation in the clinic, possibly due to less activity. This applies to just not kids alone, but also the adults. Okay, all right. So if you've got a very active toddler, okay, try to encourage time to sort of sit down. Try to recognize the sensation of wanting to pass stool. So these are toilet breaks. If you've got a potty or doing a bit of potty training, then this is the time to sort of calm them down from active play and sit down so that they recognize that there's a time to poop. Now, be patient and calm. I think if there's a heightened anxiety and the child feels it, that sometimes may be an obstacle in you trying to get your child to poop regularly. If it's still not working out well, I always say please see your doctor, because there are certain medical conditions that we do look for. If your child is having long-term constipation, no matter how much you've done, how much you've tried to improve their diet, there's something not right, then yes, please flag it up to us, okay? All right, so we go to the opposite, okay? So we switch gears from constipation to diarrhea. So again, some parents ask, you know, how do I know if my child is having diarrhea? I've heard of diarrhea. I know what diarrhea is for myself, but I don't know what it means in a baby or in a young child. So diarrhea is basically if your child's poop is more frequent than usual, so like, you know, 6 to 8 times a day, or if it's very loose, watery, you don't see very much particles in it. This can be a sign of diarrhea, okay? So there are many causes for diarrhea. One, again, if there's a change in the diet, a change of something that your child usually takes, then, you know, diarrhea can happen for that few days to a week. Commonly, I think once your child's exposed to environment, there are always germs around your environment, and some viruses and bacteria do cause infections of the gut, in which case doctors will tell you, oh, your child has GE. So GE is a short form for gastroenteritis, which is an infection of the intestines. Majority of gastroenteritis cases are mild, so meaning that if your child's otherwise active, there may or may not be fever. Just try to sort of reduce the risk of dehydration by sort of replacing fluids because he's losing more fluids from the bottom. In infants who are still taking milk as the main thing, okay, especially formulas, sometimes we do recommend a switch in the formula, especially if the diarrhea has been going on for longer than a week to 10 days. Sometimes we may want to switch it to either a soy or a lactose, a low lactose formulation or a lactose-free formulation, because what they get is basically a secondary lactose intolerance where the body doesn't absorb lactose as per normal. Okay, so lots of information for you. Okay, we go down to the hot topic of colic and reflux next. I hope everyone's still listening in and nobody's dozing off in this cool weather. Okay, so colic is basically common in young infants, okay, especially in the less than 4 months old. Some older babies may not sort of satisfy the colic condition, but they tend to be colicky, so it's like a description where it's very similar. So lots of crying certain times of the day, quite regularly, and it lasts for a few weeks. Baby seems like they've got lots of gas to pass, nothing comes out. They curl, they stiffen, they seem to be in some discomfort, and the rest of the day they're a happy baby otherwise. So that puzzles parents because they be like, you know, my baby was fine in the morning, afternoon, and then suddenly in the evening, my baby's turned to a different baby, lots of crying, not sure what's disturbing him. And it's worse usually between the ages of 4 to 6 weeks. So that's about 1 to 1.5 months old. And a lot of times, this colicky, gassy periods actually get better by the time your baby is 4 to 6 months. A lot of parents say, oh my goodness, that's a very long time, doctor. It's true, okay, but I would say that in a lot of cases, you don't have to wait till 4 to 6 months for symptoms to get better. A lot of times it does improve. I think the worst period I always tell parents from observation is usually at about the 3-week, 4-week, up to about the 6-week mark. Majority, I would say, settle down after that slowly, okay. A few actually persist longer than that. So what to do, okay, and when do you need to see your doctor? Okay, so we don't know exactly why some babies are colicky, why some babies are not. It can happen to any healthy baby. The triggers, okay, I think they've done lots of research for colic, but unfortunately in this day and age, there's still no clear reason that, oh, okay, is that problem or is this problem? Maybe it's certain sort of immaturity, like your baby's gut system is just not mature enough, so that's why it causes all that gas, that discomfort that your baby's experiencing. Maybe it's certain milk proteins in some babies that's causing this problem. If mommy's breastfeeding, I always say that, you know, if you notice that certain foods give a lot of gas for yourself, okay, then you may want to cut that down, especially if you're breastfeeding. Some scientists have said that, you know, it might be just a manifestation of baby just being overtired and overstimulated from the environment. That's one of the reasons that scientists have put to for explaining colic. Okay, so what can you do as a parent? Okay, so keep the environment cool. If the adults get all sort of agitated and upset, I think the babies feel it and they get sort of more upset. So keep the environment cool, quiet. Okay, if it's in the evening, which is the most common period for colic, then you may want to just dim the lights just to sort of keep everything low and quiet and dim. A good way is basically keep your baby close to you, so in a swaddle, or you can just carry, okay, and close to you such that baby feels and hears your heartbeat. Gentle sort of massage of the tummy does help sometimes. A bit of sort of gentle rocking or swaying movements, like a bit of a repeated movement sometimes helps. So don't be too vigorous because that's not safe. So just be very, very gentle and slow rocking and rhythmic movements help. Frequent smaller feeds, if you find that your baby's not wanting to feed, it's okay. Just do small feeds and then stop, and keep baby in a more upright position such that if there's any gas that is trying to come out, the gas comes out more easily. If your baby has a pacifier, you find that baby sort of settles more if baby sucks on something, you can offer a pacifier if you think that soothes baby down. If baby rejects it, that's fine. Don't stuff it back in the mouth if you don't have to. Now, certain worrying signs, if you find that something's just not right, then please see your doctor, because we need to make sure it's nothing to do with twisting of the intestines or any blockage that's causing pain. Your doctor may prescribe some wind drops, probiotics. I think these have been still under sort of study. Okay, this has been ongoing for a long time. In some babies, this has been effective enough to help with the crying. They find that it helps with the crying duration. It helps with the symptoms that baby is experiencing. So see a doctor, and your doctor would advise appropriately. Yeah. Okay, so we go on to the next topic of reflux, which is what I think some of you highlighted as the main concern that you have for your baby in the poll earlier. So with regards to reflux, is again something that is very common in a young baby. So spitting up a little bit of milk comes up each time after a feed or when you're burping. Majority is not serious. It's actually normal. Okay, as part of a baby's sort of digestion and gut. Some milk comes up because they're mainly on a liquid diet that comes up more easily than solids. Generally, again, it gets better as your baby grows older, okay? And what you may have is basically frequent spitting up, some arching, some discomfort. What is important is basically making sure that your baby's gaining weight. So if your baby's not putting on weight as much as you or your doctor would want him to do, okay, then that's certainly one of the red flags that doctors do worry a bit more. If your baby is having lots of frequent spit ups and not putting on weight, then that may signify a more serious form of reflux. And we also need to exclude other causes of vomiting. All right, so what to do if your doctor says that, you know, I think your baby's all right, it's just reflux. Okay, there are certain things that we can do and certain things that you can do as parents. So positioning measures, okay, you may need to hold your baby in a more inclined position after feed especially. So you can do it either over your shoulder or carrying, but with your arm at an incline. Medications, sometimes, okay, we don't use medications for all babies with reflux, only if it's bad enough, okay, or it's affecting your child's growth, then sometimes doctors may prescribe some anti-reflux medication. Thickeners, okay, to make the milk a little bit more thick, such that it's less likely to come up and bring up the acid from the stomach. That's something that may be useful in some babies, okay. I think some of you may have heard of this partially hydrolyzed formulas. So I'll talk about them a little bit later in my talk. So don't worry if you have no idea what these are. So these are some of the formulas that are meant to help you if your baby has some of these symptoms. Probiotics also I will touch on later in my talk. So some of these are basically useful in some babies who's got reflux, a lot of gasiness, or you just cannot tell the difference. Is it reflux? Is it colic? Then probiotics sometimes may be prescribed by your doctor for your baby. Okay, so we go on to probiotics, all right? Okay, so what is gut health? Okay, what is microbiome? I think some of you may have heard of this either from the net or from friends. I think these terms have come about and have been more popular in the recent, I would say 10 years, 20 years. So gut health is basically, you know, when we have food or milk going into the digestive system, that's where most of our intake gets processed. That's a very important part of our body because that's where, you know, nutrients get absorbed. And that's where immunity also happens. So you'll be trying to link, you know, how does infections have to do with my gut? So the main thing is basically a lot of our immune system actually comes from the gut. So I would say like 60–70% or even more in some studies. So immunity basically starts from there and you know, continues there. So what we put into our gut is really important. So what is good gut health? Okay, is equals to a good balance of bacteria. So we want some good bacteria, and some bacteria do exist in our gut. So a balance is very important. Okay, so too much of one thing is no good. You must have a good balance. Okay, so what are the signs of poor gut health? So some parents will say, how do I know my child has good gut health or poor gut health? You know, what do I do and what do I watch out for? So poor growth is one of the signs, okay. Gasiness, if a child, even beyond infant stage or toddler or even school-going children, if you find that your child's, you know, quite prone to having gasiness, tummy upset, a very sensitive stomach, then this may be a sign that your child's gut health may not be as good as it should be. Tummy pain, nausea, vomiting, these are also common symptoms that signifying poor gut health. Okay. Okay, so let's see. So this gives you a whole long list, okay, of lactobacillus species, which is a very sort of common probiotic. It's been probably one of the most studied or one of the more studied gut bacteria that has been around for a long time. So you can see all the long names that are so difficult to pronounce. Okay, so don't worry about that. Okay, so gut health and probiotics. So probiotics are basically good bacteria. Okay, like what I mentioned, a lot of our immunity for the body is within the gut. So what does all these good bacteria do? They basically help to fight off the bad guys in our stomach and our intestines. Okay, so certain strains like Lactobacillus rotary, okay, has been shown to have benefits, particularly in children with digestion issues, constipation, gasiness, okay. So it's been very studied in this group of children. All right, so always discuss with your pediatrician to see if it's suitable, okay, or if your child needs to sort of some probiotics to help. Always discuss with your pediatrician if there's anything to exclude, or basically just work on improving good gut health. Partially hydrolyzed protein formulas, okay, so milk, that contains protein. So protein, if you think of it as like a strip, when you sort of cut that little strip of protein into smaller pieces, okay, it's easier for digestion. It's sort of the body recognizes it as something different. And basically for partially hydrolyzed protein, okay, the milk proteins are just pre-processed such that the pieces get broken down to smaller pieces. It's easier for digestion. The size of the protein ends up smaller, okay, than the original cow's milk protein, which is where formula milk comes about, like cow's milk based. And basically, it's been studied to show that in some babies, basically, there's been some advantages, that there's prevention of allergies in families who are very allergic, for example, asthma, sensitive nose, eczema, and that in this high risk group, is there anything that you can do to sort of prevent the baby from sort of developing allergies? So I think allergies basically is a multi-trigger thing. So it's not just what you take into the body, but also genetics play a part, external factors like the dust might load in the house. So all these play a factors in allergy, but certainly I think in terms of prevention, I think in this group of children, I think the partially hydrolyzed formulas have been pretty well studied and have shown to be of some benefit. Now, with regards to gut symptoms, so I think we talked about in an otherwise healthy child or baby who may experience some gut problems like constipation, gasiness, abdominal pain, or colic, for example, then in this group of babies, I think the partially hydrolyzed formulas have been also studied because they want to know, is there anything sort of natural or something that can be done as part of their diet to improve the symptoms? And that's where the partially hydrolyzed formulas come in. So if you look at the picture up there, you see a normal protein. They break down the chains into a partially hydrolyzed form in the second picture. And then you've got some specialized formulas that are called extensively hydrolyzed formulas. So those are not the same, okay? They get broken down into extra small, okay? And these are mainly reserved for the truly cow's milk allergic babies and children. So these are usually as a recommendation from your child's doctor. Okay, so we'll just focus on the partially hydrolyzed formulas for now. Yeah. Okay, so I'll leave some time for questions. So I'm just going to end off with my last slide, basically on tips, okay, for parents. So parenting is a very long journey. Okay, for those of you who are new parents, you know that it's probably one of the toughest part of your life, especially when baby's a newborn. Try to enjoy every stage as much as you can because parenting goes a long way. Okay, be a good role model. Okay, so for children who are fussy, picky eaters, be a good role model. Show them to eat vegetables and fruits, and you take sort of extra note to have them in your diet. So good gut health is very important for all ages. I would say not just for the kids, not for the babies, but also for us as adults. So ensure a balanced diet and healthy lifestyle for the whole family. And if you're unsure about your child's gut health, then please seek your pediatrician's advice, okay? So we can target sort of to your child's needs accordingly. So again, I mean, probiotics all come with extra long names, extra hard to pronounce. Bifidobacterium is a group, again, of probiotics. They've been also very widely studied. In fact, it's one of the probably the most studied group of probiotics. Again, I think it's been fairly sort of well studied in the aspect of gut health and in helping babies and children with regards to those who have fussy feeding, poor poop, or rather irregular poop, or sort of stools that are, not due to a medical cause, but basically just not sure what is producing that gas or that irregular poop. Basically, this group of bacteria has been found to be pretty useful in these children as well. Now, it's also been studied in the aspect of immunity. So basically reducing the rate of infections or the frequency of infections as your baby and child grows up. So again, that has to do with probiotics and gut health. So again, that has been an aspect that has been studied. Okay, so I think it's not sort of easy to decide, is it this strain that I need, that strain that I need, and you basically just discuss with your doctor, and your doctor can make the relevant recommendations. So I think a lot of foods that you get off the shelves can be very difficult to ascertain, like, what is the right amount of salt? Is this too much, too little? I think it's really hard to know, but I think that dairy is important because of the milk content, especially in children. If you can sort of compare labels and find the one with the lowest sodium, I think that's right for your child. If you can find a low salt version, that's even better, because your child probably doesn't need that additional salt in the diet. Try to look for sort of cheese that is less processed, because again, we don't really want processed foods in our babies and children's diet. Okay, so again, so choose wisely. I wouldn't say allow your child to take too much cheese. I think it's just part of the dairy that your child should have on a regular basis. But if you find that cheese, no matter how you search, is still pretty salty, then just give a bit, but try to introduce alternative forms of dairy. Again, this form parts of weaning food. So I think that there's no real need to start your baby on solids before the age of 4 to 6 months. I usually tell parents you can wait a little bit closer to 6 months. Yogurt is of a texture that's easy for babies to sort of, they don't need to chew, they put it in the mouth and they can swallow. So I think the texture of yogurt is suitable. It may not be the first food that you introduce. I always say start with something like rice cereal or like a vegetable base or fruit base, which is natural. Now, yogurt, again, I think they're again going to be very varied brands, choices on the supermarket shelves. So again, if you just compare, you want to choose the less sweet ones. And basically, I think there are some that they say is baby yogurt. So if you look at the labels, I think the sugar content is less, and look for one that is less processed. I would say that at age you can start after about 6 to 8 months old. There's no need to start too early. Okay. Yeah, so I think it's part of our body's reaction. So after you put something into our gut, there's a bit of a gastrocolic reflex, meaning that it triggers your gut to sort of squeeze, and then poop would come out. Especially in young babies, I think after a milk feed, a lot of parents know that, okay, it's time for me to change the diaper soon after this. So it is normal. I don't think it's something abnormal that is like, it's quite abnormal. Is it the nutrients are not getting absorbed? That's why whatever goes in comes out. So whatever's coming out is definitely not from the last feed that you're feeding. Okay, so don't worry that nutrients are not being absorbed. So as long as, remember, the consistency of the poop is important. So if your child's poop is basically pasty, color is in the good colors that I talked about earlier, then you don't have to worry that it's a problem that your child poops straight after eating. Okay. So I think some babies are ready to start solids before they turn 6 months. On the other end of the spectrum, there are some babies that are just refusing solids no matter how parents try, and can be very frustrating, because all of my friends' babies have started, I'm trying to feed my child, but my child just refuses every time I offer solids. I think there are certain sort of conditions that we do sort of exclude. Sometimes it's basically the texture, because solid foods are of definitely a different texture compared to milk. So So some children are particularly sensitive to that texture in the mouth, and they tend to be sort of very sort of upset, or rather very apprehensive whenever you put something other than liquids in the mouth. So in this case, then I think it's something like what we call an oral hypersensitivity syndrome, in which case then it may take a bit of time for baby to get used to different textures. So sometimes we get a speech therapist to help. Again, we don't force, because by forcing, sometimes that makes the child even more averse to trying. So we try to do it in a playful manner. We try to do it in a more encouraging manner, but sometimes we may have to sort of spend a bit of time just to find out what exactly is it, at which stage of the feeding is the problem for baby who's refusing food. Okay, so just to share, I mean, sometimes we just check in the mouth, make sure that there's no ulcers, because sometimes, when they put at the stage of weaning, they tend to put fingers in the mouth. Sometimes sharp objects or even the fingernails can scratch, and sometimes that can cause pain, and that may cause temporary rejection of food. Okay, so it really depends on the scenario. There are various reasons. So I think if your child's still not accepting food by 9 months, then please consult your doctor so that you know like what to watch out for, and your doctor can also help to check to make sure that there's nothing else except that it's just sensitivity to certain textures in the mouth. So pale stools that I talked about, which was one of the not good colors. Okay, so basically pale as in like clay colored or beige. I think the parents asking about pale yellow. So I'm not sure how pale or how yellow it is, but I'm assuming that there's still a yellow tinge to it. Yeah. So go through your food that you have fed your child in the last few days. Was there anything that was a bit more light in color that you've been giving more regularly? So if it's just temporary, like a one-time poop, and after that the subsequent poop goes back to your child's usual color, I think you don't have to worry. But if your child's poop persistently seems pale and you're really not sure what color it is, like it doesn't look yellow to you, then please just err on the side of caution and either take a picture or bring it in a diaper to show your child's doctor. In a sense, it could be related. I would say that because sleep, you need to feel comfortable in order to sleep well. If there's some stool at the anus that's not coming out, it's just stuck there, then that may impact sleep because your child's just not comfortable. So assuming there are separate issues, then I think sleep by itself is, I see a lot of sleep cases. So it really depends on what the triggers are, or, we have to sort of do a search to find out, is it something that's affecting your child's sleep? So I think it's quite difficult in this platform to sort of explain that, but basically for constipation, I think we mentioned it earlier, basically go through your child's diet. Is it your child's basically not getting enough fiber-rich foods or fluids? So if you want, you can increase like fiber-rich foods. So for example, if your child's a toddler, you can give more brown rice. You can give more green leafy vegetables, so increase the spinach chopped up in the child's diet. Prunes, okay, is a good form of a natural laxative, so it does soften the stool. It does cause a bit of urge to pass motion. So introducing some prunes, like pureed or chopped up in the diet may help. Bananas, okay, or papayas are also useful foods to introduce if your child is frequently constipated. If it comes along with tummy discomfort that you think that's causing the pain at night, or your child's not sleeping well because of the tummy, then again, I think we need to address the tummy issues before your child can sleep better.